The topic under discussion is ketoacidosis, and in this lecture, we'll talk about the stress induced ketoacidosis. And in the last lecture, we discussed diabetic induced ketoacidosis. So, before we commence the lecture, I will tell you people first of all the definition of the stress induced ketoacidosis. Then, I will tell you that how this is actually going to be caused, means we'll talk about the pathophys. Second, first of all, we'll define. So, let's define ketoacidosis or stress-induced ketoacidosis. First of all, let me tell you people what is ketoacidosis. Blood pH, if it changes because of the ketone bodies, it is called as ketoacidosis. Now, the term here is acidosis. Now, what does it mean? Very simple. These ketone bodies are actually responsible to make the blood pH acidic. Got acidic. So now, because of these ketone bodies, the blood pH is becoming acidic. So this is called as what? Ketoacidosis. Ketone bodies are responsible to cause blood pH acidic. So acidosis is actually caused because of what? Because of ketone bodies. That's why it is named as ketoacidosis. Now, if this ketoacidosis is because of stress, then it will be named as stress-induced ketoacidosis. In the last lecture, we discussed about the diabetic. Now, in some cases, there is diabetes responsible to cause ketoacidosis. So now here we'll be talking about the stress, that how the stress is responsible to cause ketoacidosis. Got stress will cause the synthesis of ketone bodies, and these ketone bodies will change the blood pH in sense of what? In sense of acidity, means the blood pH will become acidic. So such kind of acidity, when achieved, is named as stress-induced ketoacidosis. Very simple. Just concentrate. Once again, this stress is responsible to synthesize ketone bodies. Then these ketone bodies are actually responsible to change the blood pH in sense of what? Acidity. It will cause acidosis. So now what is this? This is actually stress-induced ketoacidosis. Very simple. Now here this concept will become more easy and understandable when I explain the entire pathophase. So let's come to the point, pathophase of the ketoacidosis, stress-induced. Now what is happening? In the stress, actually, there is the involvement of epinephrine and norepinephrine. And we know these are responsible for emergency situations. In emergency, these tackle the system, the entire system. So now what is happening? During stress, these epinephrine, norepinephrine, they have some other functions also, but this is one of the functions. They will target what? They will target the lipolysis, means they will induce lipid metabolism. Now this lipolysis will be in sense of what? Fatty acids will undergo the beta oxidation, and this will result in the synthesis of the acetyl-CoA. And these acetyl-CoA, we know that these are responsible to move towards the Krebs cycle, and they will generate ATP. Got? Now this is the energy production. What happens when there is stress, enough stress? So in that condition, there is actually excessive lipolysis that will result in excessive synthesis of the acetyl-CoA. And this acetyl-CoA, when it is synthesized in excess, they will saturate the Krebs cycle. So now, if the Krebs cycle is saturated, what will happen then? The rest of the these acetyl-CoA, they will move towards ketogenesis, means they will synthesize the ketone bodies. And I told you in the beginning, ketone bodies are responsible to change the pH. Now, how it is changing? Very simple. These ketone bodies in blood, they actually deprotonate. They are providing protons. And then those protons are actually responsible to do what? To induce acidity. Acidity. What? Acidity is actually induced. So now acidity, because of the ketone bodies and because of the stress, is named as stress-induced ketoacidosis. Stress, first of all, synthesized the ketone bodies, then those ketone bodies induced acidity. So this is actually known as ketoacidosis due to stress or stress-induced ketoacidosis. Hope it's clear.